Let's be honest, we all know a shift starts before you even step foot in your unit. What you wear sets the tone for your entire day, and that's why I love Figs. Figs make scrubs for modern medicine. Back in nursing school, I was handed boxy, scratchy scrubs that felt like wearing a paper bag. Figs changed everything. They're form-fitting, insanely comfortable, and actually made for people who work in healthcare. They're antimicrobial to help keep you protected, durable enough for wash after wash, and look so good you actually want to wear them. If you're getting your first set of Figs, I'd go for the Catarina top and the Cade pants. The Catarina has this easy, relaxed fit that I love, and the Cade has cargo pockets for everything you need within reach. You can get 15% off your first order at wearfigs.com with the code FIGSRX at checkout. That's wearfigs.com, code FIGSRX for 15% off.
5 a.m., I'm up with a crisp Celsius energy drink. Running 12 miles today. Grab a green juice, quick change, and head to work. Meetings, workshops. One more Celsius, no slowing down. Working late, but obviously still meeting the girls for a little dancing. Celsius. Live, fit, go. Grab a cold, refreshing Celsius at your local retailer or locate now at Celsius.com.
Hello there, I'm Nurse Mo, and welcome to Mo's Monday Minute, a quick shorty episode that I release on Mondays. And this one is going to look back at the episode that was released on Thursday. We're going to be doing a pod quiz about that topic. I'll ask a question, pause for a minute, give you time to answer, and then tell you the answer. It's a great way to test your understanding of the topic and prepare for exams or one-on-one with the patient at the bedside. And if you like this type of quizzing and reviewing of information, then you need to check out Study Sesh, where I go through pod quizzes on a ton of different disease conditions and must-know nursing knowledge. So check out Study Sesh if you enjoy this pod quiz. Let's get started. So last week, I shared with you an interview that I did or a presentation that was made by a dear friend of mine who was sharing ostomy tips and tricks. It was actually a lesson that I pulled from Med-Surg Solution to kind of give you an inside look at Med-Surg Solution and then also share some information about ostomy care from someone who gets it, who herself has an ostomy. So this pod quiz will be going over some ostomy basics. So if you want to dive deeper into ostomies, you can listen to that episode, which was last Thursday. It was episode number, that was episode number 473. Or of course, you can just head on over to Med-Surg Solution to get the deep dive on ostomy basics and the key things that you need to know as a nursing student. So question number 1, which ostomy typically produces the highest volume and most liquid output? We're looking at, let's say, an ileostomy versus a colostomy. So that would be an ileostomy because output from that small intestine is occurring before water absorption occurs. So there's lots of water in there. And so the output's going to be more watery. Along those lines, why are patients with ileostomies at higher risk for dehydration? So basically, this is just another way to answer or to ask the question that I just asked. And that is basically the reason is because the colon is the one that normally absorbs water and electrolytes. We're bypassing the colon because, hey, guess what? Patient doesn't have a colon, leading to those large fluid and those electrolyte losses. All right, next question. What should a healthy stoma look like? So that healthy stoma should be pink to red, it should be moist, it should be a little shiny. Sometimes you will see it referred to as a rosebud appearance. So if you're seeing a stoma that looks like a rosebud, you are looking at a healthy stoma. Next question, which stoma colors if you saw them, would be signs that something requires immediate doctor notification. So, if you're assessing your patient's stoma and it appears dusky, dark, like purplish color, brownish color, blackish color. These are all very bad signs indicating compromised blood flow. You need to let the MD know right away. If they just had ostomy surgery, you're letting that surgeon know right away because we definitely don't want to lose this stoma. And those are signs that blood flow is not great to that stoma. What ostomy output change would concern you the most? You've got a patient who has a sudden absence of output or a patient who has very high output. So this is kind of a trick question because I would actually be a little, concerned about both, but that sudden absence of output, I'm going to be the most concerned about because that could be a very acute problem of an obstruction. And we definitely want to hop on an obstruction and get that treated right away. Now, the reason I'm concerned about the high output is because the patient is at risk for dehydration and electrolyte imbalance, but that can take a little bit longer. And as the nurse, you can encourage oral intake, right? So that obstruction, though, that's going to need some advanced intervention, some imaging, etc. At what level of fullness do you typically want to change or empty that ostomy pouch? The general guidelines are 1/3 to 1/2 full. You don't want to getting much bigger than that because it does increase the risk for a leak. A leak can cause skin breakdown. The appliance can become detached. Then we're getting stool in the skin, etc. So about 1/3 to 1/2 full. Your patient has a double barrel ostomy. Which opening produces stool and which opening produces mucus? So that proximal stoma is the one that produces the stool. The distal stoma is the one that produces mucus. And why is that considered normal? So that's normal because the intestinal lining is going to continue to secrete mucus. Even when there's no more stool, no more anything flowing or coming through that segment, it's like the tissue doesn't know that it's not going to get, a Big Mac coming its way. It's still going to secrete the mucus. Which ostomy typically produces more formed stool? Which ostomy type? That would be a colostomy, and that's because it's coming from the colon. Water is being absorbed in the colon. So, especially if you have a descending or sigmoid colon ostomy, then you're going to have water absorption along the earlier parts of the colon, and then the output is going to be more formed stool. What is the highest risk time frame for developing a peristomal hernia? Essentially, this is going to be while the tissue is healing after surgery. And healing can take, a range of time. It can take 6 months, it could take 12 months. It depends on the person. Until that site is completely healed and stable, highest risk for developing a hernia at that site. So, what would be some things that would increase a patient's risk for developing a peristomal hernia? So, some things would be increased intra abdominal pressure. That could just be from lifting something heavy. In the presentation that Karen gave that I utilized for the episode last week, she knew of a patient that had lifted a jug of milk and that caused a hernia. Also, obesity, poor wound healing, patients who have diabetes, then they have that, the skin doesn't heal as quickly. If they're on corticosteroids for a long time, the skin's not going to heal very quickly. They're going to have a harder time controlling a hernia or preventing a hernia. Weak abdominal musculature would be another one. So those would be some factors associated with a peristomal hernia risk. So what could the patient do to help prevent a peristomal hernia? So they could definitely avoid heavy lifting. They need to pay careful attention to whatever their surgeon says their lifting restrictions are after surgery. They will gradually return to activity, and maybe they would want to wear a hernia belt or an abdominal support belt of some kind as they are increasing activity to help protect that site. So there you have it. Those are some overview questions about ostomies that could come up with a patient, that could come up on an exam if you are a student. So again, if you want to learn more, you can check out the episode from last Thursday where Karen shares her experience as an ostomy patient and an ostomy coach. And then if you wanted to dive deeper, I do have a lesson, a robust lesson inside MedSurg Solution all about ostomies. I'll see you again soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Rinse knows that greatness takes time, but so does laundry. So Rinse will take your laundry and hand deliver it to your door expertly cleaned. And you can take the time pursuing your passions. Time once spent sorting and waiting, folding and queuing, now spent challenging and innovating and pushing your way to greatness. So pick up the Irish flute or those calligraphy pens or that daunting beef Wellington recipe card and leave the laundry to us. Rinse. It's time to be great.